Hi everyone, hope you're all doing well today. My name is Jeremy Smith. I'm a PA at Stedman Hawkins Clinic and I work with Dr. Genuario. Just want to touch base today about rotator cuff repairs and rotator cuff injuries and answer all your questions. All right, today we're going to talk about rotator cuff repair surgery. Let's start out and review some anatomy. If we look at the picture on the left-hand side, we can see the signs of the rotator cuff tear. Right there where the rotator cuff tendon is supposed to attach to the top of the humerus, you can see there's a hole. If we look at the picture on the right-hand side, it's an MRI of a shoulder that shows a rotator cuff tear right where that arrow is pointing to the gap in the tendon. All right, let's review some different treatment options for rotator cuff tears. Conservative treatment could include physical therapy to strengthen up the surrounding muscles. Sometimes this relieves pain and relieves symptoms enough to avoid surgery, but certainly we would want to follow that with MRIs if that was the case. Another thing we can do is help out with some symptoms with using some anti-inflammatories such as a prescription strength ibuprofen or Aleve, but this is only a temporary option. Some rotator cuff tears are not repairable by surgery, and occasionally we look at doing a cortisone injection if that's your problem. And lastly, for persistent pain, weakness, we look at surgical options to treat these rotator cuff tears. All right, let's talk about what's involved with rotator cuff repair surgery and take you through the day of surgery. So first, we're going to have you arrive to surgery about 2 hours beforehand. And you're going to meet with the nursing team and the anesthesiologist. The nursing team is going to get you all prepped for surgery, and they're going to put an IV in. And then you'll meet with the anesthesiologist. The anesthesiologist will review your medical history, talk to you about general anesthetic, and talk to you about potentially doing a nerve block. We use the nerve block and rotator cuff repair surgery to help out with pain for 24 hours after surgery, but it's certainly your option. Following meeting with all them, Dr. Genuario will be by, and he'll talk to you about any last-minute questions you have, and then he'll put his initials on your operative side. Then you'll go back to the surgery room, and the surgery itself takes about 1 to 2 hours and is done through all a few portal incisions to repair the rotator cuff, shave down the bone spurs. Following the surgery, you're going to go back to the post-anesthesia care unit, and you'll typically be there for an hour or two. Make sure you're comfortable after surgery, that your pain's well controlled, that you're not nauseous. Make sure you can eat and drink something. Ultimately, this is typically an outpatient surgery, so you'll typically go home. But if there was any issues with pain control or eating or drinking, or anything else, then there is some potential to stay 23-hour observation, which means staying overnight and then going home the next day. Most rotator cuff tears are associated with a biceps problem, either biceps tendonitis or a partial tear in the biceps tendon. So ultimately, if we're doing surgery on your rotator cuff tear and repairing that rotator cuff, we want to take care of this biceps problem at the same time. One option is a biceps tenodesis, where we attach the biceps tendon in a different position within the bicipital groove. Another option is a biceps tenotomy, where we cut your biceps tendon and let it scar down on its own. Now, there's pros and cons to both of these, so we're going to give you a handout that talks about the different biceps surgery procedures. That way it can help you with deciding what biceps tendon procedure you would prefer. So anytime we're talking about surgery, we have to discuss the potential risks that are involved with surgery, although all of these potential risks are extremely rare. Some of the things we worry about is infection, nerve injury, a bleeding complication, a blood clot. Although it's very rare, we do have a little bit of increased risk living in altitude, or an anesthesia complication. And this will be further discussed by the anesthesiologist, as I discuss with you the risks of doing a general anesthetic and also the risks of potentially doing a nerve block. But ultimately, all these risks are extremely low and certainly happen less than 1% of the time. The other thing it's worth talking about whenever we're looking at surgery is what are the outcomes like? Well, ultimately, if you have a small, medium, or large size rotator cuff tear, it's very likely you're going to get excellent strength, excellent pain relief, and very rare that you'll ever tear the rotator cuff tendon again. Now, when you look at massive rotator cuff tears, the surgery can be very helpful for pain relief as the primary goal, but also can help some with strength. All right, let's talk about medications we use after surgery. And these are the typical ones we use as long as you're not allergic to anything. So we want to take an aspirin 325 milligrams per day for 2 weeks following surgery to help prevent blood clots. We also typically use naproxen, which is like a prescription strength Aleve medicine to help out with inflammation and pain. The narcotic medicine we typically use is Norco. And this is something that some patients just take for a few days or maybe up to 10 days, but it's typically very short term. We look at 2 different types of antibiotics, Keflex or clindamycin, that we take for 1 day following surgery. We also use an IV antibiotic surrounding surgery. Zofran is an anti-nausea medicine that we have for you in case you get nauseous or you're having any problems with vomiting after surgery. Valium is another narcotic that's typically used for muscle spasm or having any trouble sleeping. And this is a medicine that's typically just used for up to 10 days. Most patients just need it for a few days. All right, let's talk about the post-operative rehab protocol following rotator cuff repair surgery. First, there's the protection phase, where the first 6 weeks after surgery, we're going to keep you in a sling to allow that initial healing in the rotator cuff. Now, while spending time in the sling, there's some potential the shoulder could get pretty tight. So we're going to start with physical therapy the day after surgery with a home-based exercise program, which will help try and prevent some of that tightness in the shoulder. You'll then see the physical therapist about 4 to 6 weeks after surgery on a week-by-week basis to get updated exercises. Most patients will go to physical therapy until they're about 6 months out from surgery. Also, the day after surgery, we want to see you in the clinic, review your operative pictures, and change your dressing if necessary. Then at 10 to 14 days after surgery, we'll see you in the office for suture removal. And 6 weeks out from surgery, you'll see myself or Dr. Genuario, where we plan to discontinue your sling and see how you're doing and assess your range of motion. At 12 weeks out from surgery, you should have excellent return of range of motion, but you'll still be progressing with strengthening. We'll also plan on seeing you at that 12-week mark. We want to see you back when you're 18 weeks out from surgery too. At that time, you should have excellent active range of motion and pretty good strength, but you'll still be progressing with strengthening. At the 24-week mark following surgery, we'd like to see you for a final recheck, and you should have really good motion and really good strength. At that point, the rotator cuff in studies has been shown to be 90% healed. It's also worth keeping in mind that if the cuff's healed 90% at 6 months after surgery, you will still continue to gain some strength probably till a year out from surgery. It's also worth noting that the rotator cuff is only about 40% healed at 3 months after surgery. Finally, when we look at surgery preparation, we want you to remember there's nothing to eat or drink after midnight the night before your surgery, except we would like you to drink a 20-ounce Gatorade 5 hours prior to surgery, as this can be helpful to prevent blood clots. All right, if you have any other questions about what's involved with rotator cuff repair surgery, just let us know. Dr. Genuario, myself, or anybody on the team would be glad to help you. We'll see you soon.